The AC MEGS Clinical Practice Guideline 2, Pre-Surgical Functional Brain Mapping Using Magnetic Evoked Fields, describes how MEG can be used to measure and localize magnetically evoked fields of the somatosensory, visual, auditory, language and motor areas of the brain. The approach is to stimulate the target brain system repeatedly with relevant stimuli, then perform time-locked averaging of trials to improve the signal-to-noise ratio, SNR, by averaging out background activity. Once the SNR is adequate, localization of neural sources can be performed. The protocols described here have been created in accordance with the recommendations in this guideline. In this module, we focus on visual evoked fields, VEF. Here again is the general workflow for MEG data acquisition. This module will follow the workflow for recording magnetic evoked fields, particularly visual evoked fields, using a checkerboard stimulation. Each protocol presented in this series has a specific setup for data acquisition. In the case of visual, we will set up the projector and back projection screen, position photodiode over stimulus marker if needed, adjust image quality. VEF is measured by using the projector, the screen and visual stimuli prepared with the audiovisual stimulus delivery system. Turn on the projector. The projector should be set up as rear floor projection when using the back projection screen in seated position. Position the screen in front of the patient chair at the predetermined distance. This distance is typically marked on the floor to guide the setup. Screen should be oriented with the matte side towards the subject and shiny side towards the projector, or according to the labels on the screen. If the system has a ProPix projector with the option to trigger from pixel changes, the pixel triggering will automatically provide correct timing of the stimulus. Please consult the audiovisual stimulus system instructions for use for details. With other projectors provided with your system, it may be necessary to apply a photodiode for ensuring the correct stimulus trigger timing. Position and attach the photodiode over the white square in the lower left corner. This image shows the placement on the rigid back projection screen. Attachment on a flexible screen is slightly different. During the experiment, this square will be white when the stimulus comes on the screen and will be background color when only the fixation is on the screen. Start the visual evoked field task. Adjust the focus and the screen inside the MSR so that the stimulus images appear clearly on the screen. Instruct the patient to minimize eye movements and focus on the fixation during the task. The fixation point may vary depending on the stimulus used. Load the saved acquisition settings for VEF. Acquisition settings should be prepared in advance, then saved and loaded just before the VEF scan. Consult the MEGIN guidelines to MEG data acquisition for preparing the settings. Online averaging should be set up to monitor patients' responses for each of the different stimuli. The example here shows the event and averaging for the upper left checkerboard stimulus. Event 1 will be created when line 5 is triggered, for example when E' sends a trigger to stimulus input 5. Event 5 will be created when line 13 is triggered by the photodiode or pixel mode. For averaging, when event 1 occurs within 20 milliseconds before event 5, event 1 is adjusted to the timing of the photodiode or pixel mode, correcting for delays or jitter, and added to the average. You can use the default artifact projection settings unless CHPI is used. Then this threshold will prevent online averaging. Set max equals -1 for MEG grad and MEG mag. No rejection applied. Select Go. This will start the flow of channel data to the raw data viewer. You will immediately be presented with a dialog box asking you if you wish to perform an HPI measurement. Before measuring the head position, quickly browse through all the MEG channels using the channel group selections in the raw display. Assess any artifacts due to breathing, movement and muscle tension, and guide the patient to relax and remain still. Check for bad channels and try to resolve any issues before starting the recording. Now instruct the patient, scan is about to start, relax and try not to move. When the subject is settled, select Measure. Performing the HPI measurement is a best practice and should always be performed. This will measure the current location of the patient's head inside the helmet using the HPI coils positioned on the patient's head. Check that the coils were detected with a goodness of fit that is greater than 98%. If one coil is not well fit, the coil is placed too low on the head and outside the helmet, or it is not well oriented flat against the head. Check that at least 3 coils are available for head position measurement. The coil pair differences show the distance between the coils when digitized and the distance between the coils during this fit procedure. Large discrepancies in these pair differences may indicate that a coil has moved. Check that the differences between the good coils are less than 5 mm. A minimum of 3 acceptable pairs is required for head localization. Check the location of the head origin and ensure the patient is properly positioned in the helmet. Ideally, the Z coordinate should be within the range of -40 to -60 mm, depending on the size of the patient's head. A Z coordinate greater than 70 mm indicates that the head is too far out of the helmet. Make any necessary adjustments and repeat the measurement if needed. When satisfied, select Accept. This information will be stored in the resulting FIF file when a scan is saved. If using continuous head position measurement, select CHPI. Then select in order, Record Raw and Average. Inform the patient the task is starting. Start the visual task. Verify that the stimulus markers are being recorded in the acquisition. Typically, events will be on STI 005, 6, 7 and 8 for event-specific markers, and STI 101 composite of all event markers. Other stim channels may be used depending on site-specific setups. Verify that the epochs are being averaged, indicated in the Status Messages section of the Data Acquisition Control window. Monitor the online averages in Data Plotter. The general visual area is indicated in this image. Depending on head position, this is typically at the bottom of the top view image. This corresponds to the primary visual cortex, the most posterior part of the occipital lobe. Zoom in on the response. Shift plus left mouse and drag to zoom in. The primary visual response is typically 100 milliseconds after the stimulation, which occurs at 0 milliseconds. Left-click over the first large positive deflection to measure the latency indicated at the bottom of the window. Here you can see the 4 distinct stimuli each have their own average indicated by the different color traces. If CHPI or internal active shielding is used or other artifacts are present, it may be necessary to adjust the filter and scales to visualize the response. A low-pass filter of 45 Hz and MEG scales of -100 to 100 femtoteslas per centimeter may be used for visualization. After completing approximately 120 trials, select Stop. The first dialog will prompt the user to save the evoked responses. This will save the online averages. The second dialog will prompt the user to save the raw responses. This will save the raw data, which will be processed and used for localization. Instruct the patient the scan has stopped and they can relax. Triax Neo intended use. The Triax Neo is intended for use as a magnetoencephalographic MEG device which non-invasively detects and displays biomagnetic signals produced by electrically active nerve tissue in the brain. When interpreted by a trained clinician, the data enhances the diagnostic capability by providing useful information about the location relative to brain anatomy of active nerve tissue responsible for critical brain functions. Indications for use. The Triax Neo non-invasively measures the magnetoencephalographic MEG signals and, optionally, electroencephalographic EEG signals produced by electrically active tissue of the brain. These signals are recorded by a computerized data acquisition system and displayed, and may then be interpreted by trained physicians to help localize these active areas. The locations may then be correlated with anatomical information of the brain. MEG is routinely used to identify the locations of visual, auditory, somatosensory, and motor cortex in the brain when used in conjunction with evoked response averaging devices. MEG is also used to non-invasively locate regions of epileptic activity within the brain. The localization information provided by MEG may be used, in conjunction with other diagnostic data, in neurosurgical planning. This demonstration video was prepared according to Megin's Guidelines to MEG Data Acquisition. Please refer to this document for additional details and safety information.